Welcome to this episode of Preventing Type 2 Diabetes in the Diabetes Health Matters webinar series. This series is produced by Diabetes Africa and sponsored by Eli Lilly and Company, although they have no input into the content of the webinar series. So today we're going to be talking about preventing type 2 diabetes with two wonderful healthcare professional experts and also somebody who is an expert of lived experience. More about that later. So let me tell you about the healthcare professionals first of all. We have Dr. Charlene Shoneye. She is a dedicated diabetes educator, dietitian, and public speaker. She's somebody who has dealt with weight management, obesity, and diabetes throughout her career. Her early research explored ethnic differences in approaches to weight management and complications of diabetes. And she's somebody who grew up in London from Jamaican and Nigerian parentage, and she's got this absolute passion for promoting the nutritional benefits of traditional dishes, food, and its cultural importance. The other thing Dr. Charlene does is she's able to translate complex scientific theories into impactful education. So stay tuned. Currently, she works as an academic at Curtin University and works with the Counterweight program. Our other healthcare professional is Nana Ocran. She's a nutritionist by profession. She's got a master's from the London School of Hygiene and Tropical Medicine, and she's been working with underserved communities across London in various aspects over the past 10 years. Previously, she worked as a health and well-being coach on the National Diabetes Prevention Programme. The clue's in the title there. And then she went on to work as a diabetes practitioner on the low-calorie diet program, now known as the Path to Remission. She's currently the only diabetes lifestyle medicine coach in Lewisham, where she works in London.
Thank you so much for the introduction, Joan, and great to have everybody live here this evening. I thought I'd start off by talking about some of the risk factors for type 2 diabetes, because I often hear people talk about, well, someone's high risk, and I think, well, do we actually know what that means? So I want to just ask us to think about what is a risk factor? This is a characteristic or a feature that can impact the chance of you developing type 2 diabetes. So there are some risk factors that lower your risk of diabetes and some risk factors that increase your risk. And I think sometimes we focus too much on things that we shouldn't do, things that are going to increase our risk. But there are actually loads of positive things that we can do to lower our risk. So I've got this slide here just to show us that some of these things may be outside of our control. So, for example, you might have polycystic ovary syndrome, and that is increasing your risk. But actually, there's lots of things that we can do to lower our risk. And they include things like eating more fruit and vegetables, because we know that they have polyphenols that can help with inflammation. We know that they're supportive of us maintaining a healthy weight. And then we've also got other behaviors. So, if you manage to breastfeed a baby, that's another thing that we know can lower our risk. And I think it can be really inspiring to help people highlight all the disease risks and things, all the behaviors they're doing to lower their risks, as well as identifying things they can do to bring those risks down.
That's wonderful, Charlene, and it's really interesting to see some of those on there. I love coffee, so it's great to see the coffee on there. But I think one of the things that people don't always remember that you can do is to try and get some decent sleep.
Oh, absolutely. And so this came from a study that specifically looked at sleep, and they found that it was actually a causal risk factor. So it's not just an association. Getting less than 7 hours sleep per night consistently can increase insulin resistance, and it can also mess up the way that we relate to food. So it can make food less satisfying. So you want to eat more. And when you do eat, the food doesn't fill you up in the same way. And so having maybe a role where you work night shift, maybe you've got small children and you're not able to sleep through the night, being aware that that's a risk factor and trying to address other things or get support with your sleep could really bring down your risk of type 2 diabetes.
Fascinating. Thanks, Charlene.
So you might notice that one of the things on here I do not have at the moment is weight. And I know that weight is a big factor when it comes to risk factors for type 2 diabetes. And I think sometimes there's a lot of a shame and difficulty in having this discussion. And so I wanted to just put it into the context. We've got 4 women here and they all have different body sizes, different weights. And we know that the driver of type 2 diabetes is excess fat that's stored around the pancreas and how that impacts the body's ability to regulate glucose. But in the individual in front of you, we can't look at their body, we can't measure their BMI and know how much fat is on their liver. And also everyone has capacity to store a different amount of liver fat before it becomes type 2 diabetes. So if you think about an individual, or you think about yourself, if you're a person who's at risk of diabetes, we know that some things like having a history of depression, issues sleeping, high blood pressure, or even being born at a high birth weight can increase your risk of type 2 diabetes. And, you can't change the weight at which you were born, but if you have high blood pressure, you can speak to your doctor about the medication that you're taking and the strategies that are being used to help manage that blood pressure. We know that concordance with taking medications such as those for hypertension and depression can be quite poor. So it's worth, if you're not taking the medication as prescribed, have a chat to your pharmacist, have a chat to the doctor and try and get some strategies in place for that. We're talking about people of African descent, and we know that ethnicity also increases our risk of type 2 diabetes. But it doesn't mean that we're getting type 2 diabetes. It doesn't mean that we have type 2 diabetes. It means that we have an additional risk factor. And so we don't need to necessarily burden ourselves with this doom that about type 2 diabetes, but we can empower ourselves with some of the behaviors that we know that can also bring down that risk. So in this case, this person is of an ethnicity that has a high risk of type 2 diabetes, but by getting good sleep and by eating a plant-based diet. And when I say plant-based diet, I don't mean that it's vegan or vegetarian. I mean that the bulk of the foods there are from plants. We might still add some meats or fish or processed foods or alcohol. You might add some fast food, but the majority of the food on the plate at each meal comes from a plant. And I think we can distinguish that as one of the driving factors for maintaining a healthy weight and for lowering our risk of type 2 diabetes.
That's amazing, Charlene, because I think it's a different perspective on what we know. Can I clarify that? What I mean by that is, if we aim for every meal to have the majority plant-based, it means that you don't have to be vegetarian or vegan if you don't want to be, but by making the majority of each meal plant-based, you'll achieve what you're saying is one of the factors to help reduce the risk of developing type 2 diabetes. Great way to look at it, because it's like you can do a small step as opposed to thinking you have to change your whole lifestyle. Amazing. And I noticed you've got high muscle mass, so I know you may talk a little bit about activity, and we also have Nana who's going to talk about activity as well, I think.
Yes, absolutely. And maintaining that muscle mass, particularly for females as we go through that perimenopausal and menopausal phase, is really integral to helping our body take up the excess glucose out of the blood and bringing it into the muscle. And I'm really looking forward to Nana talking about that a bit more later. So the other thing I wanted to talk about in terms of risk factors for type 2 diabetes is medications and supplements. There's all sorts of resources online that talk about supplements that can prevent a glucose spike. So even family members of mine are ordering cinnamon supplements from Amazon. They're drinking apple cider vinegar in an attempt to reduce their risk of type 2 diabetes. And I just wanted to clarify that we don't have any strong scientific evidence that taking any of these supplements can lower our risk of type 2 diabetes. But in some cases, some of these supplements are traditional or they're ingrained in somebody's culture. And so before we say don't take them, just want to consider, are they doing any harm? Are they interacting with any other medication? And if not, then we can just educate people and support them to take them if they choose to, but not to be blinded or to believe that they are definitely going to make a big impact. And we need to focus on the behaviours that we have already talked about. In saying that, though, there are some nutrition deficiencies that are related to a high risk of type 2 diabetes. And that's a deficiency in iron, magnesium, and vitamin D. So it is worth, next time you're having a blood test, to speak to your health provider about testing to see if you have sufficient levels of those nutrients.
I think it's about choices, isn't it? It's always about choices. Getting that information, having that knowledge so you can make an informed choice, whether it's the supplement, so that can be supplementary to what the medication that you're taking, but also having that conversation, that informed conversation with your healthcare provider, so that it may be, as you mentioned, if you've got severe mental ill health and you're taking these medications called antipsychotics, there are some which have a higher risk of increasing your weight and perhaps tipping you over into type 2 diabetes, but there are some who have a lower risk. So it's about having that conversation, isn't it? So yeah, absolutely. And I love the wording that you've suggested there. And we can adapt that to suit us, but it's giving you the tools to enable you to have that informed conversation.
Absolutely, Joan. It's the tools and giving people the confidence to know that it isn't a trajectory that they're guaranteed on, guaranteed to follow. There are things we can do to slow down that progression and maybe avoid it.
Yeah.
So I am a dietitian, and so I will have to talk about dietary risk because that's my passion, that's my interest here. And so when we look at the dietary risk of particular groups of food, in terms of the risk of death, so the risk of mortality in a large population studies, we often think about dietary risks as being things like eating too much salt, having too much red meat, I need to cut back on my carbs, I need to cut back on my takeaways. But actually what the data is telling us is that it's the diet that's low in plants that is one of the biggest drivers. So this graph here is ranking those risk factors, and at the top is a diet low in legumes. So we know that yes, a diet that's high in sodium is problematic. That's second. Adding legumes can naturally decrease the amount of processed meat and decrease the amount of sodium because the legumes displace those foods. We're eating the legumes instead of those. So actually it's a win-win because then you're not only getting the benefits of the legumes, but you're lowering the risk from replacing the legumes, from replacing the other products like the red meats, the processed meats, and the unhealthy types of fat. So I just want to, I guess, promote that positive message about foods that we want to add into our foods that are low cost, foods that are quick to prepare, and foods that are good for the environment. So the legumes don't have to be soaked overnight and cooked for an hour, as I know my mum would do on a Sunday when she's making the rice and peas. When I want a quick dinner at home, I use the gunga peas or the kidney beans from the can. It's quick, it's easy, and you're just displacing some of that rice with legumes. We're still eating rice and peas. That food is integral to our culture. But by bringing in more legumes, we're lowering our risk, we're saving money, and we're helping ourselves to maintain a healthy weight going forward.
So Charlene, just to clarify, you mentioned some legumes there. So the gunga peas, the red peas, some people would call it kidney beans, other people would call it black-eyed peas. So that's what we're talking about with legumes. And the sodium is essentially, we're going to call it salt, okay? So for want of a better word, let's call it salt. And then the third thing in there is the other thing, add in some whole grains and that fibre, which is what you're going to get with the legumes and you're going to get with vegetables. So as you say, it's a win-win-win-win-win.
Yeah,
Charlene,
absolutely.
thanks.
And I'm glad you mentioned other types of beans because a study came up the other day looking at the polyphenol content in black beans. And so that's a type of chemical that's shown to be, one of these superfoods that really can help lower inflammation and risks of all sorts of disease. And those black beans, people tend to have blueberries and talk about blueberries as being rich in that. but you get 4 times the amount of that nutrient from eating black beans. It's not as trendy, people aren't making fancy smoothies with these black beans, but they're much lower cost than blueberries. They're easier to access all year round. And so we really need to home in on those cultural foods, wherever it is our ancestry's from. Legumes are part of every traditional diet. And so they're a great, when I saw this study, I was so happy because it reinforced so much of what I believe. And so absolutely right there, Joan, we are conscious of salt, and we do want to be mindful of that. But if we add more legumes and we add more vegetables, fruits and whole foods, we naturally lower the salt intake. Because despite what we might hear about adding salt to the pot, most of the salt we eat are from foods that already have salt added. And I always give the example of plantain. Okay, so if you fry a plantain, you roast a plantain and you sprinkle a little bit of salt, there might be 1 or 2 grams per person once you divide that up, how many people eat that food. But if you buy a packet of plantain crisps, and it says on the back that half a packet is a serving, but a lot of people are not going to stop at half, and we eat the packet. That is going to bring us over the recommended daily intake for our salt. And so if we're removing those processed packaged foods that have salt added, then we're really going to bring down our salt intake. And if we're adding legumes and adding more fruit and vegetables, then we're displacing those foods.
Fantastic. Thank you, Charlene.
So on this last slide here, I just want to, show you and just have a look. How can we add plants in throughout the day? What does it look like? And so for breakfast, I've got this example here: beans, avocado on toast. You might add some chickpeas to a salad. And the reason why we are focusing on these is because they have a low glycemic index. And so that means that these foods can slow down the increase in blood glucose after we've eaten a meal. And so if we're having something like bread or rice, when we add the legumes, it slows down the effect that bread or rice has on our blood glucose levels. So it's a great idea to pair up any sweet foods or starchy foods with vegetables and with legumes. They're high in fiber, and we know that higher fiber content helps with weight management and keeping our blood glucose levels steady. It's also rich in protein, magnesium, and antioxidants. All of the nutrients that we know can help us maintain a healthy weight, maintain a healthy gut, and a good lipid profile. So these are some ideas about how you can add these into your day. And then I've got some traditional foods. So this first example here is moi moi. It's made with beans. So another way of adding legumes and highlighting foods that may already be part of your traditional diet. And so maybe just eating these more frequently, more often, and embracing them is a way of adding legumes. Here I've got sometimes it's called red or a bean stew. And so this is typically black eyed peas that are stewed down with tomatoes and peppers. It's often eaten with plantain, but I would add some avocado to bring out a different type of vegetable, add some more healthy fats. That could be a lunch. And then here we've got an agusi stew. And so it's just worth remembering that these seeds and legumes all fall into this family. They're all part of the same plant. And so the agusi seed would count as a legume and provide all of those benefits. We might not think of it when we think of legumes, but they certainly count. And you notice here that the swallow is a smaller serve. We're still eating our traditional foods, but it's a smaller serve, and we're adding lots of extra vegetables. And just a reminder that peanuts are actually not a nut. So fun fact, peanuts are a legume. So we're snacking on peanuts, particularly if they're shelled and they have that red outer layer for even more fiber. They're not coated in salt or any other chemicals. We're just eating the nuts. It's a great snack, and they are a good legume to add to your list.
That's fascinating, and you're making me absolutely starving here, Charlene. And it's really great fact to know about the peanuts, and I love them like this. I think we should just put a little bit of a warning in here, because like you were saying with the plantain crisps, I know lots of people who would buy the massive bag of these peanuts and eat the whole bag. We're talking about a snack rather than, eating the whole bag as a snack. One of the other reasons why I like these is you have to put some effort into it. So sometimes, all of us have seen it. People open the bag into the mouth, just pouring it in. But with these, you have to shell it, the big shell, and then eat that brown bit because that's a bit more fibre.
Absolutely, and it takes time, and as you said, Joan, it slows down the rate at which we're eating, and sometimes that's part of the problem, is that we're eating too much because we're in a rush, we're distracted, we're doing something else. I give these to my children. It's a great way to slow them down, build up those dexterity skills in their fingers, and it's a nutritious snack as well, so it's a win-win.
You've given us so many positive things, and quite often people are dispirited by the thought that they may not be able to eat the foods that they want to eat. But you've given us so many tips here, which are all positive, about positive choices that we can make or adaptations that we can make. So thanks so much, Charlene, and I'm really looking forward to hearing what Nana has to say as well. And then we're going to pick up, there's going to be so many questions, I know that. So we'll pick up some more of these themes in the Q&A. Thanks so much, Charlene. That was really great. Thanks. Welcome, Nana.
Thank you.
Welcome. It's wonderful to have you. You are a diabetes lifestyle coach. So we're really looking forward to hearing what you're going to share with us this evening.
Thank you. And thank you, Charlene. What I'm going to try and do is use a consultation as an example of some of the things that come up when I speak to my patients in my clinic. So hopefully we'll to tie together everything Charlene has already told us. So this lady is a typical patient, I would say. She's 56, Black African from Congo. On her records, her BMI is 28.98. She had a fasting plasma glucose test 3 months earlier. Her reading was 5, which makes her normal. 2 months, a month after that, she had another one, and it had gone up slightly to 7. And her latest reading was 8. In her records, it also says she has sickle cell disease. So she comes to me, and the first question I always tend to ask my patients is, why do you think your blood glucose levels have risen? And normally what I always hear is, Nana, it's my diet. I used to eat very healthily, but now I've kind of snacking a lot more, been working from home a lot more, so my diet has definitely changed. The other thing is my physical activity levels. I used to try and do at least 10,000 steps a day. Now on a good day, I probably do 4,000. So that also has definitely changed. And I think those may be the reasons why my blood glucose levels have gone up. I'm also working a lot more from home now, and that means I'm tending to eat lots of takeaways, snacking, and so on and so forth. Brilliant, I say. You are absolutely right. Those things, those changes would definitely have an impact on your blood glucose levels. What about your sleep, I ask? She says, my sleep is terrible. I've been really stressed lately, not been sleeping well at all. But I didn't think that would have an impact on my sugar. I said, okay, it definitely has. We'll talk about that a bit more later. Next question I ask is, what about your stress levels? Oh, goodness me. My stress levels have skyrocketed because I've just started this new job, as I said, and really struggling to find my feet. So to summarize, many people know that diet and physical activity can have an impact on their blood glucose levels, but stress and lack of sleep is not usually considered as a factor. Would you agree, Dr. Joan?
Absolutely, Nana. I think we said this with Charlene as well, that people don't recognise that the sleep is so important into having an effect on your blood glucose levels, whether that's the development of type 2 diabetes or in terms of reducing the risk of developing it. So yeah, sleep is so important, and stress. I think people might more understand stress having an effect than they do realise that sleep has an effect. Yeah, absolutely.
The next question she asked me was, Nana, every time I come and see you, you take my waist circumference. You're the only healthcare professional I see who does this. Why is that? Why don't you just use my BMI like everybody else? So I have this slide, this photograph in one of my drawers, and I always bring it out and I say, look, Dr. Charlene talked about it earlier. BMI is only looking at your height looking at your weight based on your height. So as you can see in this picture, the two ladies have exactly the same height, the same weight, the same BMI, but their distribution of body fat or their percentage of body fat is completely different. And Charlene said earlier about where you store your fat makes a difference to how your body behaves. So if, for example, this lady has a lot of fat around her middle area where all the organs are, it can have an impact on her health. So I tend to use waist circumference instead. It's just an easy way of getting a rough idea of where fat is stored in the body. And there's been a lot of research to show that people might lose inches and not lose any weight and still have better cardiometabolic health. So you can improve your blood glucose readings, for example, just by losing fat in the right area.
Absolutely. And I think this is vitally important. The body mass index, which is BMI, is one way of getting an indication, but it's and we've said this before, it's a very rough idea. If you want to be much more sophisticated like Nana, you do the waist circumference, because the waist circumference is going to tell you if somebody has a high BMI, and we always use this example, athletes are going to tend to have a high BMI. But if you measure their waist circumference is going to be within what we call the normal range because they've got a slim waist. And carrying that weight around the waist is indicative. It's giving an indication of probably what's going on underneath the skin, and that you may be storing excess liver fat, you may be storing excess fat in the pancreas, and that's what's doing the damage. So these are like external signs of what might be happening internally. But, the most sophisticated way would be something like a CT scan, and that's not going to be appropriate to do on everybody. So we have these tools to help us to get an indication. Thanks, Nana.
The next thing we discussed was the benefits of exercise. We all know the benefits of exercise are tremendous. Now, the reason I particularly brought this up is because the lady talked to me about doing steps. And a lot of my patients are happy to tell me 10,000 steps, 8,000 steps. But then there's something missing. And if you look at the WHO guidelines, it is actually in there that for additional health benefits on at least 2 days a week, do some form of muscle strengthening activities. But we tend to just ignore this. I think I have a rough idea why this is, because it's more difficult maybe to incorporate into your daily activity, into your routine. Steps is so much easier to do, no effort required really. Just make sure you walk a lot more. But this one takes a bit more planning. But it can be done. So muscle strengthening exercises at least 2 days a week. And if we look at this diagram here, like I said, if exercise helps with the pancreas, it helps with the circulatory system, it helps with the adipose, i.e. losing fat. But then there's this bit here about muscle. So the muscle is so important, especially for glucose uptake after you've eaten. So 80% of the glucose is taken up in the muscle. So really, the more muscle you have, the more glucose can be taken up by these muscles. And then it will end up improving insulin sensitivity, and also the glucose and the fatty acid oxidation happens in our muscles. So please, just want to remind everyone to do some form of muscle strengthening exercises. And it doesn't have to be going to the gym. You can do it at home. Resistance exercise really are just physical exercises that improve strength and endurance. There are lots of different ways of doing this. Lunges, squats, when I say press-ups, no, press-ups, no. But yeah, there are lots of different exercises we can do ourselves to improve our muscle strength.
I'm hearing your message, Nana, and this is a message I need to receive as well. That I absolutely, holding my hands up, I need to do it. I do a lot of the steps, but I don't do enough of the muscle training. And I think the plank is another way of doing it, because when you're using your body weight, and we're talking about legumes, those, and Dr. Charlene was saying about you can get them from the cans as well, using 2 of the cans and doing some biceps curls, is it? Yeah? Bending your arms. Yep, there you go. So you've got a win-win. Then you can open up the can and have your legumes as well.
Yes, brilliant. Oh, bottles of water is the other one.
Bottles of water, yeah. And then you can drink the water, yeah.
Yes. I also just wanted to quickly touch on sleep. I mean, we've talked about sleep already, but then sleep is such an important aspect. It's an opportunity for the body to repair and rejuvenate itself. And there have been some research that shows that when you are sleep deprived, the glucose uptake into fat and muscles that I talked about earlier is 30% reduced. So just think about it. The more you deprive yourself of sleep, the less that function, that pathway is working. Also, Dr. Charlene said this as well about the hormones. So when you're sleep deprived, the 2 hormones that are responsible for appetite and satiety, leptin and ghrelin, they get all muddled up. Yeah, so they don't work as well as they should. And I don't know I'm sure I'm not the only one. When I don't sleep well, the next day I just want to eat sweet stuff. I just find myself craving donuts and things that I don't normally eat, and it's all to do with that the hormones that are responsible for appetite regulation being all messed up. So yes, please try and get enough sleep. And it's not just about getting enough sleep, it's about the quality of the sleep. So if you slept for 8 hours and you woke up 5 times to take a wee, I would guess that sleep was not great quality. And one way of knowing is if how you feel the next day. If you feel really tired halfway through your day, or you find yourself very irritable, or you find yourself finding it difficult to concentrate on anything, then you know you probably didn't get enough sleep. So making sleep a priority is one way of just managing this. And there are lots of tips on how to do this. Finally, my favorite slide. So this is a continuous glucose monitor. In the NHS, it is prescribed for everyone who has type 1 diabetes can have a prescription for this. But if you have type 2 diabetes, there are quite a few, what's the right word, John?
Criteria.
Thank you.
Is the diplomatic one.
So not everybody can get it. But some of the providers have free trials on their website. So I always encourage my patients to give it a go. Go and apply for a free trial of the sensor. Use it for a couple of weeks. They only last a couple of weeks. Use it for a couple of weeks and see if you find it helpful. And most of the time they come back and tell me, good grief, Nana, that was a life-changing gadget, because they can see straight away what's happening to their sugars as they eat, as they move. And why I actually show this sensor reading. Let's say you did a finger prick test, which is what the traditional way of checking your sugar. You did a finger prick test at this time. Let's say this was maybe 11 o'clock. Your blood glucose reading, perfect. You do another one. Let's say this is 5 o'clock in the morning. Perfect. You think, oh, I'm doing really well. but you've missed out the fact that you had this massive big spike, which is what we're trying to avoid. So having a sensor like this shows you everything that is going on in the background that you probably wouldn't have known about if you hadn't had this sensor. So the question I'm asking here, does this mean you no longer need lifestyle support? I'm sure Dr. Charlene will be saying, no, you still need us. Yes. So I still hear people saying, okay, I've seen that when I ate my breakfast in the morning, when I had the cornflakes, I had this massive big spike. Do you have any suggestions on what else I could try? So they'll still come back and ask for advice and stuff like that. But the beauty of it is you see it yourself. You can make your own decisions. You can go for a brisk walk after your meal. You see your sugar going down, then you know, wow, that really does work. Okay, so I think I will end on that note. I love this gadget, and if anyone can get hold of one to give it a try, please do. Thank you.
Thank you so much, Nana. I mean, I think it's about whichever tool you use, that tool opens a window in a way onto what is happening. And if it can open a window and enable you to discover what is happening with your blood glucose when, as you say, you go for a walk, or as I'm going to be doing now, doing some weight training, then it can actually really help and illustrate to you how best to live healthily with type 2 diabetes, or potentially, as we've been talking about, help to put it into reverse or remission. So thank you so much, Nana. Thank you so much, Dr. Charlene. Now, let's hear from our expert with lived experience, because her experience was one that we can all learn from. She was told she had prediabetes, but if you listen to what happens with her, she subsequently finds out something else. Let's go to Juliana.
My name is Juliana Boakye-Danquah. I am Black British, and I'm African, obviously. I am married and I am 64 years of age, married with 5 children and 14 grandchildren. And and I'm a foster carer. My mom was diabetic and she apparently passed away through that. So I was a bit worried about that. So I just went into my GP and said, I want to have a blood test. So apparently when it came up that I was pre-diabetic, even the nurse said, the next time I visited, so what made you come to us? And I said, because of my mom's condition. And I know that I'm growing. Actually, I am 64 years now. And because I'm growing, I just thought it wise to come and check. And I realized, because I had a friend who was diabetic, she did not know until something happened before they realized. So that made me have the thought that, no, I need to go and check in. So that was when I realized that I was pre-diabetes. And after that, they advised me, the nurse told me I have to change the way my lifestyle, that means i.e. my diet, and I have to do a bit of movement. So that is when it clicked me that if I don't take care, I might take the route of my mom. So I decided what to do. I spoke to my children, and fortunately for me, one of my daughters, she's called Jenny, she told me, Mommy, I've done this program where we exercise is for everybody. Then you post your exercise there. When you post it, where everybody will be congratulating you, say, oh, good job done, that kind of encouragement. And so, Mommy, I think it will be a good idea. So I did that, and my friend, the nurse, too, advised me that you have to be going for diabetes prevention class. And I said my doctor did not recommend it. So I literally went back to the nurse, the diabetic nurse, and I said, no, can you refer me? And so they refer me. So that's when knowledge came. So I started this class, and every week, I think we were doing it for quite of time. So that is when they were talking about our diet, exercising, good sleep, stress. So I wasn't thinking that to the extent of reversing it, but I don't want to have the complications my mom had. The first thing I thought of, that one, I knew my mom stopped eating sugar. So I said, in the class, we were taught to come out of sugar. So if we can, I came out of sugar, and I made my mind that anything that will increase sugar, like donuts, cakes, and things, I'm going to come off of it. So I came off of sugary food, drinks, fizzy drinks. I stopped, and I was drinking a lot of water, cutting down carbohydrate, coming off fruit juice and fizzy drinks, and started drinking water more. I was drinking a lot because we were told that water too was good. So I started drinking water. And at a point, now I have to deal with the carbohydrates. And I didn't know how to do it. I love my African food, African fufu, bankum. I love them. So I've been thinking about it. And a friend told me, oh, there's something people call swallow on YouTube. And how do you do it? So she showed me, I went on it, and I said, even though it's still not the same, but it will help. Because I don't know, especially me being African, if you look at our diets, the carbohydrates is more than, we don't eat a lot of vegetables. That is the problem. So I was finding it difficult. So I decided to, like when I do something to supplement my banku and the fufu I love. So I realized, I found it on YouTube, when you buy like broccoli, cabbage, you blend it, take the water, and I saw, my friend told me, psyllium husk, if you heard of it. I buy it in Holland and Barra. So I put it, and then whilst I've blended it, try to take some of the juice out of it, add it, and then try to, so it was helping a bit. So when I do soup, so when the family are eating the fufu, that's what I tend to eat, and it helps a little bit. But at a point too, then I started trying to eat vegetables more. At first, it was difficult because it's not in the way of but now I love it so much that if I don't eat vegetables, it looks like I haven't eaten any food. So even I've come out of the fufu and that kind of thing, because now I can eat broccoli, I boil it, put it in the soup when they are eating fufu, and I feel like I'm eating fufu. When they are eating banku, kenke, we have it with fish and the sauce. I will boil it and dip it in the sauce and everything. I eat it with the vegetables and the proteins and the sauce, and I feel fine. So the exercise too, let me talk about the exercise. The exercise upon what my daughter, we do up the cave, but at times they run. So I went on YouTube, and then I found something called glucosezone.com. They put exercise to prevent diabetes, to reverse pre-diabetes, and exercise for that. And I said, good, this is what I wanted. And the good thing is it was free on the thing. And it's like half an hour. When we went to the diabetes class, we were advised to do half an hour exercise. So I thought it was good. So I was doing the half an hour exercise. So I tried to do it 5 times a week. 5 times. I couldn't do it every day, 5 times a week. At times, obviously, I might miss some of them, but that was okay. So this is what I did to change my lifestyle, but there was up to a point too. And so one day I took a test, like, when you are diabetes, every now and then, 6 months, you go in. So I went for the test, and I went to the doctors, and the doctor said, wow, you are no more diabetes. And I said, no, I know I might not be pre. He said, no, and you are not even pre-diabetes. And I said, glory to God. So I was so excited. And I said, I need to keep it up. I don't want to go there again, because to be honest, always my thought is that I ate myself to the diabetes, so I have to eat myself out of it. So if I've come out of it, then I need to maintain it. So I can eat everything, but in moderation. That one, I didn't want to go back to like eating myself. So in moderation, I always make sure on my plate, half, a quarter is carbohydrates, a quarter is protein, and half is vegetables. The most important is cutting down your food size, like decreasing your carbohydrates intake and cutting the size of your food. That is one. Like I was saying, I used to have 2 potatoes, but my nurse said, no, it's too much, so I cut it to 1. And then 2 is exercise, physical exercise, about 30 minutes, not a lot, 30 minutes a day, and not even 7 days a week. You can do it 5 days, after 5 days, because I was doing it 5 days and it worked. So 5 days will work, 30 minutes. And then the last one is sleep as well. If you can at least have about, I think normally they say depending on your age, but I think 7 to 8 hours sleep will be fine.